One of the most exciting days is here, the embryo transfer. This is the day filled with hope, excitement, and the possibility of a new beginning. For me, it's the most magical moment of the whole process. You see your embryo or embryos for the first time, and suddenly everything feels real. All the hard work, all the sacrifice, everything has led up to this moment, and now you are here. You have done a great job. In this video, I will give you some tips to help you relax and make the most out of this wonderful day. Hello everyone, my name is Anna and I'm an IVF patient advocate and medical researcher whose mission is to support individuals and couples on their fertility journey. Today you're going to learn how to prepare a smooth and stress-free IVF experience abroad. The embryo transfer usually takes 10 to 15 minutes if it's an uncomplicated case. There is usually no need for anesthesia, although there may be some exceptions depending on individual circumstances. Even though it's not a long and medically difficult procedure, it's the most important moment for you and you don't want to jeopardize it by making small mistakes that can lead to chaos and stress. You want to have a smooth experience and leave the clinic with the best feeling ever. So here are some steps we need to go through to make that happen. You will be a little bit anxious in the morning, so it's good to have all prepared with direction to the clinic, an application or phone number for a car service, or even arrange the taxi in advance. Do not forget your identity cards. The clinic must verify your identification for everyone's security, so without those it will be impossible to proceed. Ideally, you should read informed consents in advance and have questions ready in case anything is unclear. It's a lot of paperwork and signing it in a hurry can lead to problems later. If you have not done this prior, then contact your clinic coordinator and make a plan. They may ask you to come in early for your appointment to complete this task. Follow your protocol and take all prescribed medications as directed by your IVF clinic. Follow the clinic instructions about having a full bladder before transfer. Usually a half-full bladder is recommended for the transfer procedure. If you have a nervous bladder and need to use the toilet often, just keep bottles of water handy and continue to hydrate frequently. If you have surplus embryos, they will be vitrified and stored in cryostorage for further use if needed. This is a very individual decision based on the quality of your embryos and based on your decision how many you would like to transfer in further attempts. Check the clinic's policy on whether your partner can be present during the embryo transfer. Have your credit cards or cash ready with the amount requested. There will be a lot of going on and nervousness can lead to unnecessary mistakes. Sometimes payment is requested in advance, sometimes the clinic will charge everything on the day of the egg collection or embryo transfer. So make sure you have the financial part covered. Wear comfortable clothes to the clinic on the day of the transfer. Continue with your treatment plan. Your IVF specialist may make some adjustments. Make sure you have enough medication and understand the next steps. Do not make any changes to the protocol unless they have been discussed and approved by your IVF clinic. Resume normal activities gradually after the first day, but avoid heavy lifting, strenuous exercise, and sudden movements. Prolonged bed rest is not usually necessary. It's best to seek advice if there are individual recommendations for your particular case. Eat a healthy, balanced diet, rich in fruits, vegetables, lean proteins and whole grains. Limit caffeine and avoid alcohol, smoking, and any food or drink your doctor has advised against. Take showers instead of baths and avoid swimming pools, hot tubs, and saunas to reduce the risk of infection. Light spotting can be a positive sign, so don't freak out yet. It can be caused by the implantation of the embryo into the uterine lining. However, always keep your IVF clinic informed of any changes or concerns to ensure the best possible post-transfer care. Schedule a beta-HCG blood test approximately 10 to 14 days after the transfer to confirm the pregnancy. Report the result to the clinic for further instructions. If the test is positive and levels are high, you will usually continue on your medication until 12 weeks gestation and then start to taper off according to clinic's instructions. If the test is positive and levels are low, you will usually continue your medication and take another test in 2 days to see if the levels have doubled. Report this to your clinic and continue to follow their instructions. Sometimes late implantation shows as low levels, but everything is fine. And if the blood test is negative, you may be told to stop the medication, and ideally, the clinic should offer a follow-up call to discuss with you the next steps. Call a doctor and go to hospital if you have heavy bleeding or severe abdominal pain, fever or sign of infections, or any unusual symptoms that cause concern. Thank you all for joining me today. I understand this can be a challenging journey, but I hope this video has given you some guidance and reassurance along the way. For more information, I welcome you to visit my website aboutivf.com, where you will find all the necessary materials and contact details if you have any questions or you need individual support. Whether you're a passive user of my website or actively seek to work with me, you can be sure that you, as a result, will gain confidence and improve your IVF experience. Take care, try and stay positive, and remember that you're not alone. Together we'll travel this journey with hope and determination. If you like this video, please share, like, comment and subscribe. Thank you again, and I'm going to see you with the next episode.